Tent cities are forming around health facilities in Gaza as doctors struggle with shortages, fatigue and airstrikes. Gaza City. As rain down on neighborhoods and refugee camps Gaza, hundreds of Palestinian families are setting up makeshift homes in an unexpected location. Common areas of hospitals. Tents are set up in hospital corridors, parking lots and courtyards as families seek safety in and around medical facilities that must be protected under international humanitarian law. It's just latest sign of the new reality as Israel-Hamas war reaches its 29th day on Saturday. With shortages of medical supplies and growing fears that explosions will disrupt vital health services in hospitals and clinics, families in tents with only fabric walls for privacy continue their daily routines. Sleeping, eating and trying to re-establish a sense of normalcy. These tents began appearing just a few days after the war began on October 7. These tents not only serve temporary shelters for those fleeing death and destruction in residential areas, but some are also being used as makeshift operating rooms and emergency rooms. The death toll of Palestinians soars. It exceeded 9,000. Privacy is a distant memory and the challenges of living in hospital are manifold. Food, clean water and toilet facilities are heavily rationed and only occasionally available once or twice a day. A family of 7 sheltering in a tent told Al Jazeera anonymously about the difficulties they experienced. They stated that they had no protection against nearby shelling and the debris it had collected, as well as freezing cold at night. Overnight we had everything. Now we have nothing, said one family member. As medical treatments continue in other nearby tents, families like theirs face the increasing possibility of infection and contact with toxic chemicals. Lack of medical supplies. Health facilities in Gaza reported shortages of medical supplies. According to Palestinian Ministry of Health, the shortage has become a serious problem for both medical staff and patients, causing quality of healthcare to rapidly deteriorate. The shortage of anesthesia was clearly evident at Al-Shifa Hospital, the largest health facility in Gaza, which was established in 1946. Doctors there are reportedly forced to operate on patients without medication to relieve their pain, causing them indescribable pain. Meanwhile, intensive care units, or ICUs, have too few beds to accommodate hundreds of patients with serious injuries. The Indonesian Hospital, which serves more than 150,000 residents in northern Gaza, is on the verge of ceasing operations, causing alarm among health officials. Al-Shifa Hospital is also on the verge of closing completely. The hospital that provides critical health services to central Gaza may soon be unable to accept any more patients or treat injuries. With only 546 beds, it currently treats more than 1,000 injured people. The hospital even resorted conducting surgeries in its own